Good evening, Mr. Smith. My name is Jackie. I'm your student nurse for today, and I have with me the clinical examiner who's going to be assisting me. What I'm wanting to do, I have a order today to do an abdominal assessment, and I was wondering if this would be a good time. Okay, do you need to urinate or use the bathroom at this time? If your patient needs to use the bathroom, you make sure that they have their slippers on, or those hospital issued socks, and so before they hit the floor, before their feet touch the floor. Okay, you may want to raise the bed if it's low at this time for your comfort level. Your patient's positioned back in his bed. You make sure that you can place a pillow behind the patient's head so they'll be comfortable. Explain to them you are going to have to lay, I would like for you to lay in the supine position or lay flat. Is this comfortable for you? Okay, I'm going to raise your legs. You can raise your legs up to your knees. Okay. Thank you. And we want to make sure that your abdomen area is the only thing exposed. So I'm going to, you have your sheet down here, and I'm going to use a hospital gown to cover up your upper half. So I can just expose your stomach. Okay. With the arms laying to the side. Is this comfortable for you? Thank you. So we're going to look first at the stomach. Looking for any distension, looking for any peristalsis, any movements, looking for scars, any wounds, or ostomy bag. Then take your alcohol pad. You're going to ask the CE for the stethoscope. And you're going to clean your stethoscope and warm it in your hand. If your patient does have wounds, you will don gloves this time. In the event that your patient does not have any open wounds or an ostomy bag, then you don't don gloves. Okay, you're starting at the right lower quadrant. You're listening for bowel sounds as we watch, so you can check how many seconds. Wonderful. Moving up to the right upper quadrant, over to the left upper quadrant if you are hearing bowel sounds. And then the left lower quadrant. Wonderful. Now you're going to feel, you're going to palpate starting at Mr. Smith. I'm going to touch your stomach, and I want you to tell me if you're going to feel any tenderness, you feel any tenderness or pain. Okay? I'm lightly touching all of the 4 quadrants. When you're looking at your patient's face to see if there's any grimacing. Is that comfortable? You feel anything? Okay. Now, your doctor's also ordered for me to measure your abdominal girth. So I have my little hefty tape measure here. I'm going to need you to roll. Let's put this under your arm. I'm going to need you to roll over just a little bit to your right. And then bring your body. If you can lift your hips, that'll help. Wonderful. Onto your left. And I already know what site was measured first. Inches. And it's right at the umbilicus, right at the navel. Thank you. Reposition your patient. Let's make you comfortable again. You can go ahead and put your legs down, making sure your patient is covered. And if you want this sheet removed, get your sheet removed. Is there anything I can get for you? You okay? You comfortable? Anything for pain? Thank you very much. And thank you for allowing the Excelsior students to care for you today. Safety, make sure your bed is back down in the lowest position. Call light within reach. And phone is within reach.